Hello, everybody. Welcome to another episode of What's Next After BDS. Today, we have Dr. SWETHA Bhaskaran, my UG batchmate. Currently, she has cleared her Australian Dental Council exam, part one. So, Shweta, can you give a short intro about yourself?
Hi, Vinay. Thanks for the intro. I'm Swetha Bhaskaran and I'm Vinay's batchmate. And so both of us cleared in 2015, right?
Yeah, 2015.
Yep.
Correct.
So after graduation, I went back to Malaysia and then I
Okay.
worked in Malaysia for 2.5 years.
Okay.
And then after that, I came to Australia
Hmm.
and then sat for the part one exams.
Okay.
Which was supposed to be in March 2020, but because of COVID, it was postponed to
Okay.
September. And so basically, these ADC exams, they have like three parts. So basically, the
Okay.
first part is just a very simple thing, which is the assessment part, where you have
Okay.
to collect all the documents, all the requirements they want lah. So you have to get
Okay.
all those things,
Okay.
and then once that is cleared, then you will sit for the part one exams.
Okay. Okay.
Okay.
Okay.
So this validity of the assessment is for 7 years. So
Okay.
if that expires, then you'll have to do this assessment all over again.
Okay. Okay.
All right.
Okay.
Yeah.
So
Then
the
the
first,
first, yeah.
yeah, please, you tell me.
Sorry.
Tell me.
No, you ask first. Then after that, I go
No,
on.
I was interrupting you. Okay. Anyway, so the first thing is I wanted to ask you is, yeah, that's okay. The first thing I wanted to ask is like after your BDS, like somebody who's finishing the graduation from India, so you do they need the work experience which you got in Malaysia to write the ADC, or they can just show the documents and directly write part one ADC?
No, it's not necessary to have your working experience. If you have,
Okay.
then they will ask you to like show the like evidence proof and all those things. They will ask for letter of recommendation and good
Okay.
standing from the Malaysian government. So
Okay.
because I worked in Malaysia for 2.5 years, that yes, I had to do that.
Okay.
Also, I needed like a transcript from Ramachandra
Okay. Okay.
because they wanted the theory and practical hours. So that
Oh, that's
I
good.
didn't have with me. Yeah,
Okay.
so I got that done. But like this whole assessment thing, it took 1 year for me to like collect everything
Okay.
because
Okay.
like I'm not staying in India, so it took time for me to get these kind of documents.
Correct. Correct.
But
Correct.
like for students who did their undergraduate in India and they are living in India, it'll be easier for them. Yeah.
Correct. Correct. So, can you briefly tell us what are the documents required to apply for the ADC Part 1?
Yep. So they will require like for me, they ask letter of recommendation, like 3 letters of recommendation, and then a letter of good standing from the government of Malaysia. And then they require like normal like passport, and then
Okay.
our degree.
Hmm.
Degree is required. Also internship certificate if we have it, then they will
Hmm.
ask for it. And then what else, yeah, the transcript where you show the number of clinical hours and also theory hours with saying that this course is conducted in English, so they want to know
Okay.
all those
Okay.
things. Yep.
So the internship
Yep.
is not
And
mandatory, is it?
sorry.
The internship is not mandatory, is it? Because you said if you have, you can show it, right? That's what I was
Yeah,
asking.
so they will ask there whether you've had this internship program or anything like that. So I think in India, it's everywhere we go, we have this internship, right?
Correct. Correct.
Probably in
Correct.
some countries, they don't have
Okay.
internship.
Okay.
So
Okay.
that's why if so they put that optional. If you have, you can provide. Mm.
So, what is the exam pattern of ADC Part 1 and how different is
Okay.
it from Part 2? You have cleared Part
Okay.
1, right? Yeah. Yeah. You told me earlier.
Correct.
Yeah. Correct.
Yes. So part one is like they have divided it into 4 papers. Okay. When I said so now
Okay.
they have actually revised the format and it's a new format already. So when
Okay.
I sat for it in September 2020, it was it was divided into 4 papers. The first paper was purely prosto, second paper
Okay.
endo,
Okay.
third paper was mixture of a lot of others like pedo and all those things.
Okay.
Third and fourth was a mixture. So
Okay.
basically all our final year subjects are in there. Also you have a bit of farm and all those things inside. they'll ask you a few questions regarding medical emergencies and all those things. So one paper consists of 80 questions, and those questions are like I would say 80% scenario based and 20% single best answer.
Okay.
So that was the format. But right now, I'm not sure. But everything, they have it on the website, the ADC website.
Very easy
All the
website.
format, everything, they have it over there. So whoever who wants to, look up, they just have to go to the website and, you can get everything over there.
That's good.
Yeah.
That's good. So you have writing your clinical subjects in part 1. So what will your part 2 be about? Is it going to be more of practical?
Correct. So part 2 is purely like hands-on. So that's also over 2 days. So the part 1 is also over 2 days. Okay. And the part 2 is over 2 days as well. And okay, I forgot to tell you. The first part is actually computer. It's online, and you'll have to go to a center. Everything is, you just go there, the computer-based system lah. So you go there, you write exams over 2 days. And part 2, the only center is in Melbourne.
Okay.
Once you clear part 1, you only have 3-year validity period for that written examination. Okay, you have to clear sit for part 2 within that 3 years.
Okay, if I'm not wrong, that documents which you collected for the first part, you have a validity of 7 years. Whereas if you clear part 1, your validity is just 3 years, and it takes place only in Melbourne, right?
The part 2. Part 1, they have a few centers, but part 2, you only can go to Melbourne to sit for the exams. Also, I would not recommend anyone like outside of Australia right now to sit for the exams because of this, like, they have this validity period. And if you pass your part 1, good, but you are unable to come into Australia right now because of COVID. So I would actually suggest people not to sit for the exams right now because of this thing. But otherwise, well and good. They can
well
come.
and good. That's good. So unlike the DDS, we were talking to SWETHA the other day, where she had to clear her NVDE part 1 and part 2, and then she had to go through all her training in the school, right, for DDS. So do you have to undergo such training, or once you clear part 2, you're eligible to practice in Australia?
So once I clear part 2, I can just be registered. I'll be a registered dentist. As you know, I have to register myself as a dentist, and then I can start practicing.
Okay. So you don't have to undergo any formal training for that.
No. But that's an option. If you want to, if you don't want to sit for these exams, you can go for dental school over here.
Okay.
Yeah.
That's good. So what was the cost of your exam fee, part 1?
Okay. So the cost for the assessment is $600 Australian dollars. Okay. The first part is 2,000 Australian dollars. And the second part is 4,500 Australian dollars. Okay. And I forgot to tell you that earlier you asked about the part 2, right? What is it about? So over 2 days, you have technicals, which covers 6 tasks. So the first, I give you all the examples like what they usually ask. They give you a crown preparation with porcelain, with a crown. You have with the provisional material. And then complex amalgam. That means it's a huge cavity with a cast buildup. Okay. And then they give a complex composite as well. Okay. And then they will also test you on endo excess cavity and also cavity preparation. And this, you have 6 hours to finish this whole thing. Okay. And they will test you on all those things and also infection control. So that will be your first day. Second day is mainly like OSCEs. So like Viva back in
clinical scenarios.
Correct. So these like 10 stations. And then you will have like the first 6 stations will be like basically a dentist and patient interview where you have to like, they divide it into clusters where you have information gathering. There'll be 2 clusters in information gathering, 2 clusters in like diagnosis and management, and 2 clusters in clinical treatment and evaluation. So
Okay.
you have to like know where to start. Like if it's clinical
Correct.
information gathering, you have to like build a rapport with the patient and all those
Okay.
things. When you start with diagnosis and management, you have to like start in like you base on the scenarios they give you, you just have to start from there. Don't start like if it's a like a diagnosis management, you cannot be talking about yourself to the patient at that time because you're
Correct.
already
Correct.
halfway through the examination.
Correct.
So you
Correct.
need to know when to start. All those things they will take into consideration. So those are like the 6 stations. Then the other 4 will be like testing you on local anesthesia, extraction, x-rays, root planing, all those things.
Okay.
And infection control is
So,
very important over there.
so you have done your undergraduation in India, and you have a 2.5 years of work experience in Malaysia, and then you go to Australia to write your Part 2 exam. Now, my good one question is like, although dentistry is like overall a similar aspect, there are certain change in protocols which is followed by one country, and it slightly varies from one country to another country. So do you think it will make a difference, or do you need to know what exactly the Australian Dental Council expects from you for Part 2? Because I'm sure there'll be slight variations, right, when it comes to the protocol.
Yeah, like here, infection control is very, very important.
Okay.
So like burrs, when you want to change burrs, you're supposed to use a tweezer to change your burr.
Mm-hmm.
And like everything you have, everything is clear, like you're clean and you're dirty and where the places, right? You need to make sure which one is clean, which one is dirty, because you can't just simply use your gloves and open a dirty area because you're going to use that into your patient's mouth. So that is very important over here. And also I realized that when I practice with my friends while doing role plays for the patient and dentist interview, empathy is very important over here.
Okay. Okay.
Okay, you need to really empathize with the patient, and here everything is like uh ethics is also very, very important.
Exactly. Exactly.
Okay, so like you really need to know what you like, your knowledge has to be like all up to date. You need to know everything
Okay.
because
Okay.
patients can also sue you.
True.
That's
True.
also something that's, yeah. So yeah, I guess like what's very different from India, Malaysia, and here, I think for me it's like I see what I can practice here. It's just basically infection control and like the ethics and the empathy towards
Okay.
patients.
Okay.
Mm-hmm.
Okay. And you have training centers in Australia where you said you're practicing the role
Correct.
play thing. So you have training centers
Yes.
in Australia, right? So that
Yes. Yes.
will help you or what do. That's good. That's good.
Yep. And also I have like a mini home setup because you need to practice at home. So I have like a compressor, dental unit, everything at home so I can practice like on mannequins and all those things.
Oh, that's good. That's good. What else
Yep.
do I want to ask?
So
So,
I want to tell you, I want to really like emphasize that money, financially, you have to be mentally prepared to spend a lot for
okay.
these
Okay.
exams
Okay.
because yeah, it's a lot of money, but at the end it is all worth it because
Mm,
once you become a dentist over here, it's quite good. Yeah,
quite good. And you can apply for your master's after becoming a dentist there also.
correct. Yes.
And someone who has done their master's, say MDS in India, if they come to the ADC, do they have an advantage or something like that? Like they get an exemption from Part 1 or something like that? Nothing.
Nothing like that. You have to do the whole thing.
The whole process
Because
from
I have
first.
friends right now who are like pedodontists,
Okay.
periodontists. They are all both we are all in the same group right now.
Okay.
So all
Okay.
the same.
All the
Mm,
same. That's good. That's good. So
yeah.
one final thing is like if someone who wants to settle down in Australia or have plans of coming to Australia to choose dentistry as a career, what would you, say something short and sweet so that helps them out in their future?
No, it is a good country to come to, but you have to like make sure everything is proper, like your visas. It's tourist visa, it's I mean right now the visa wise is quite difficult to come in because of
Mm-mm.
COVID, mainly because of COVID. I'm not saying anything else. It's mainly due to COVID. It's a bit tighter over here. But otherwise, you can just come and what do you call this? Um, just be mentally, just like I said earlier, be mentally prepared that this exam is a very long, and
Okay.
it can be long for some people, it can be like straightforward for some people. It's quite exhausting, stressful. I'm saying a lot of negative things over here, but at the end of the day, once you are done with these exams, you are all good to go over here.
Okay.
And
Okay. So that's
make sure that
quite
you
common for every
follow
exam.
all the,
Yeah.
sorry?
That's quite common for almost every exam, the stress and all that,
Correct,
exhaustion.
correct. Yes, yes. But like, um, because mainly like I'm also like that, because like I came from Malaysia and I was working there. So for me, I can feel like a lot of frustration as well, because I'm thinking like I worked, I had my degree already, but again they're testing me on everything.
Exactly.
It's quite
Exactly.
frustrating. So
Mm-hmm.
like it's like doing it all over again. So
Okay.
it's
Okay.
just something that's quite time consuming also. But at the end of the day, when I think like, okay, when I'm done with these exams, I can actually start working, and it's good life over here.
That's good. That's
So like what I would tell people would be like, um make sure if you want to come and do the exams, make sure you're doing everything right, like regarding the materials, like for part one and all, the materials that you read, make sure you are all like everything is updated, because
okay.
sometimes like the versions can be different, like the books and all. So make sure you're reading
Okay.
the right books. And if you feel like you need help, don't be shy. Just ask for help from, there are so many
And
guides that are available online also. Like I myself, I joined a group because I wanted like a mentor for me over here, because I didn't want to
okay.
like waste time not knowing something when I have a
Okay.
guide and I can clear my doubt there and then.
Okay.
So yeah, do just those things.
Thank you. Thank you. And is it okay if I can share your email ID as a part of this video? So if somebody is interested, they can contact you.
Yeah, sure, no problem.
So, okay. Thank you, Shweta. All the best for your part two, and see you soon as a successful dentist in Australia.
Thank you.
Thank you. Thank you.